So what are all the parts? So the nerves of the popliteus crosses the popliteal artery, runs downwards and laterally winds round the lower border of the popliteus. Lower border of the popliteus is the favorite space for everything. Okay, and supplies it from the deeper anterior surface. Okay, back to the whiteboard. So we have got the popliteal artery over there and the nerve over there, right? So what is it gonna do? It's gonna come lateral to medial. So it's gonna come like that, run down, and then what is it gonna do? Under the lower border of the popliteus and supply what? Popliteus. This okay, it's gonna supply the popliteus muscle from the floor. Okay, it's gonna supply it from the floor. This is the contents. It is gonna supply from the floor. That's it. Okay, it's gonna underground and supply it. What is it gonna do? It's gonna go deep. It's gonna go under the artery. And what is it gonna do? It's gonna cross laterally, and then it's gonna go to the lower border, deep down, supply it from the anterior surface, the popliteus. Okay, so what are all the parts that we got? It's gonna supply the popliteus muscle. Okay, it's gonna supply the gastrocnemius, lateral and medial, and it's gonna supply the popliteus. It's gonna supply the this one, and then soleus, and then it's also gonna supply the plantaris. Okay, so we have seen how it supplies the popliteus. By the nerve to the popliteus are okay. So while it is going to the popliteus, what are all nerve to the popliteus? Okay, the nerve to the popliteus is a nerve. So popliteus muscle is gonna get supplied. Okay, and then the tibialis posterior, below the tibia, so tibialis posterior, and then superior tibial fibular joint, because right, tibia, intraosseous membrane, inferior tibia fibular joint. What are all the okay? So we got the popliteus muscle, and then we got the superior tibiofibular joint, inferior tibiofibular joint, and then the intraosseous membrane, and then we got how many? 1, 2, 3, 4, 5, 6. 6 parts is a place. Okay, the tibia as a whole, and then the tibialis posterior. Okay, tibia anterior, tibia posterior. Tibialis posterior is also supplied by this. Nerve to tibia supplies popliteus muscle, and then it's gonna supply the intraosseous membrane. It's gonna supply the tibia. It's gonna supply the intraosseous membrane. It's gonna supply the tibia. It's gonna supply the superior tibiofibular joint, inferior tibiofibular joint. 4 now done. Popliteus muscle is 5, and then it's gonna supply the tibialis posterior. 6. Okay, now moving on to the genicular or articular branches arise in the upper part of the fossa. Upper part of the fossa. Okay, now superior medial genicular nerve. Okay, medial genicular nerve between the medial condyle of the femur. Okay, pierces the posterior part of the capsule of the knee joint, supply structures of the intercondylar notch of the femur, the inferior medial. Okay, so when we talk about the 5 genicular branches, what were all? The superior medial, superior lateral, so inferior medial, inferior lateral, and intermediate one. Correct? Over here we don't have that. Rather we have the superior genicular, the inferior genicular, and the middle genicular. Okay, so when we talk about the superior genicular, superior medial genicular. Okay, superior medial genicular, it's gonna supply the medial condyle of the femur. Medial condyle of the femur. Okay, and then what else is gonna happen? Calm down. And then it's gonna supply the capsule, the posterior capsule, and the intracondylar notch of the femur. Okay, and then come even more down, inferior medial genicular nerve, upper border of the posterior popliteus. Finally, upper border is also getting supplied, not just the lower border. Upper border of the popliteus is also getting supplied by the genicular branches, and it reaches down. Okay, to the medial condyle of the tibia. I mean, it reaches up to the medial condyle of the tibia, right? The medial condyle of the tibia. Okay, so what are all the areas that it supplies? So we have got the crescent like this. I mean the rhomboid like this. Okay, so like this. Okay, rhomboid like this. So we got the superior medial genicular, which supplies the medial condyle, okay, of the femur, and then we got the middle genicular branches which supply the intercondylar notch and the capsule. Okay, and then we got the low inferior genicular branches, which is going to supply inferior medial genicular branches, which is going to supply the upper condyle or the upper medial condyle of the this one tibia and also the upper border of the popliteus. Okay, that's going to be genicular branches for you. And then cutaneous is also called a sural nerve, which originates at the middle of the fossa and leaves it at the inferior angle. It's going to continue as the inferior angle. Okay, it supplies the skin of the lower half and the whole of the lateral border of the foot till the tip of the little toe. Full lateral till the tip of the little toe is done by sural nerve. Okay, 7 minutes and we have completed one. Next, moving on. Before that, let's have a look at the tibial nerve. Okay, so the tibial nerve comes like this. We have got the plantaris and the medial head of the gastrocnemius. So it's going to divide into two: the lateral head and the medial head. It's also going to supply the plantaris, and it's going to supply the 3 genicular branches because it's fully medial. It's fully medial. Okay, so it's going to supply the superior medial, and the inferior medial. And then popliteus is going to get supplied from the lateral area only. Popliteus and the superior tibular fibular joint. Okay, superior tibular fibular joint. Nerve to popliteus. Okay, nerve to popliteus supplies the superior tibular fibular joint as well, right? And then apart from that, it also supplies the soleus because it's the medial part. The tibial is posterior. The flexor digita longus. Okay, and the flexor hallucis longus. Okay, the last one, the first one. Okay, medial plantar nerve, lateral plantar nerve. That's it. Okay. Tibial nerve, plantaris, medial head of gastrocnemius, lateral head of gastrocnemius, genicular branches, posterior, popliteus, superior tibiofibular joint, soleus, tibialis posterior, flexion. Okay. The lateral side. All the muscular branches of tibia arise from its lateral side, except the nerve to the medial head of the gastrocnemius that arises from its medial side. Okay. The medial side is more safe. That's it. Medial side is more safe. Popliteus and soleus is in the medial part. Okay. And then common peroneal nerve. Moving on forward, common peroneal nerve. Dorsal divisions L4, L5, S1 and 2. 3 is not there. Smaller branch, smaller terminal branch. That was the larger terminal branch. Superficial plane as the tibial nerve is same plane. Extends from superior angle of to the lateral angle, not to the inferior angle. It supplies to the lateral angle along the medial border of the biceps femoris. Okay, like this. There. Okay, along the medial border of the biceps femoris, continuing downwards and forwards, it winds around the neck of the fibula, pierces the peroneus longus, and divides into superior, superficial, and deep peroneal nerves. Tibial nerves divide into nothing. It just continues to the back of the leg. This divides into superior and superficial and deep. Okay, it divides into superficial and deep peroneal nerves. What was the thing that we had over there? We had deep peroneal nerve, right? No. We just had peroneal nerve. That's it. Superficial and deep peroneal nerve. So this has only cutaneous and articular branches. Okay, that had cutaneous, muscular, and genicular branches. We will see what is the difference between articular and genicular in a minute's time. Okay, so there is the superior lateral genicular nerve. The lateral cutaneous nerve and the sural communicating nerve. The lateral cutaneous nerve of the calf descends to supply the skin of the upper two-third of the lateral side of the leg. Lateral cutaneous nerve of the calf. Okay, it's all 316. Okay, great. Lateral cutaneous nerve of the calf descends to supply the skin of the upper two-third of the lateral. Okay. Sural communicating nerve. Sural nerve is from the tibia. Okay, which part of the tibia? It's gonna be the cutaneous nerve. Okay, the cutaneous nerve is the sural nerve. Okay, sural communicating nerve is from the common peroneal nerve. Remember that. Arises in the upper part of the fossa, runs on the posterior lateral aspect of the calf, and joins the sural nerve. Sural communicating nerve arises in the upper part of the fossa, runs on the posterolateral upper part of the fossa, runs along the posterolateral aspect and communicates with the sural nerve. Posterolateral and communicates with the sural nerve down. Okay, so this is going to be the sural communicating nerve. Okay, sural communicating nerve. And then, so what are all the cutaneous nerves that we got? We got the lateral cutaneous nerve of the calf, and we got the sural communicating nerve. That's the cutaneous branches. The articular branches is going to be superior lateral, inferior lateral, and recurrent genicular nerve. Articular nerves are the genicular branches only. Superior lateral, inferior lateral, and recurrent genicular branch. That's it. Okay, artery of the same name. Okay, so here's the thing. The common peroneal nerve supplies with respect to the artery. So the superior lateral genicular nerve and the inferior lateral genicular nerve is supplied along with the arteries of the same name, whereas the recurrent genicular nerve is going to be divided into the anterior and posterior parts. Okay, we have already seen that. Okay, so that was about the branches of common peroneal nerve. Now moving on to the posterior cutaneous nerve of thigh. Very little, we don't have much over here. It is a content of the upper half of the popliteal fossa. Okay, I told you know the roof of the popliteal fossa. Okay, we got from the roof of the popliteal fossa we got only posterior cutaneous nerve. We didn't get genicular nerves, okay, of the obturator. We didn't get genicular branches, and we also didn't get we don't have genicular branches up there. Okay, we got medial. Okay, we will be having medial, which is not mentioned over here, and then we will also be having this one. What is that? Medial from front, posterior, posterior, and then we got the common. No, we got what was that? Peroneal or okay, communicating nerve. Communicating nerve from the common peroneal nerve. Okay, sural communicating nerve from the common peroneal nerve. Okay, so we got all these things. From that, common peroneal nerve, from the anterior aspect medial, from posterior. So from that only posterior and the common peroneal nerves branch is there. That's it. Okay, so now going on forward. Posterior cutaneous, content of the upper half of the popliteal fossa, Here's his deep fascia about the middle of the fossa and supplies the skin up to the middle of the back of the leg. Supplies the skin up to the middle of the back of the leg. That's it. Genicular branch of obturator nerve. This is the continuation of the posterior division of the obturator nerve. Correct? It runs on the posterior surface of the popliteal artery. Runs on the